Um, Thanks for having me here, and thank you so much for giving me a relatively unconventional topic to speak, though I would confess that I chose it for myself. It just goes to show to what extent social media has become a part of our lives, and we haven't even realized it, and it's become an integral part of our lives. The Imagine this: you are sitting in your OPD clinic, and there are patients who are waiting for 2 hours for you, and you are called in to do an emergency surgery somewhere, and those people are still waiting. Guess what they are doing at that time? They are checking the Facebook status updates, and they are making updates on their Facebook account. And guess what they are writing about you? This doctor is too busy. He doesn't have time for us. I've been waiting here for 2 hours. Dr. Arun Prasad does a wonderful robotic bariatric operation in a gentleman. He's walking the same day. Next day in the morning, his breakfast arrives 15 minutes late. Guess what's going to be on social media that morning? Dr. Arun Prasad, great doctor, but the service in this hospital is very poor. My breakfast came 15 minutes late. You just can't help it. Whether you like it or you don't like it, people are going to be talking about you and the services that you provide on social media. It's everywhere. So we might as well learn, we might as well know how to make use of it, how to harness the power of social media for our own benefit and for the benefit of our patients. Okay, so going forward, it's pretty interesting to note that about 70% of the people who are on Facebook check their Facebook accounts every day. And the numbers are less for the other social media platforms, but it's really amazing how much it has become a part of our lives. And there are a number of different social media platforms available, the most popular being Facebook, and then Twitter, LinkedIn, YouTube, you have the whole thing. And there are a number of ways in which you can use these platforms to inform your patients, to inform the general public about the work that you do. And if you talk about Facebook, which has 1.5 billion account holders in the world, and by the way, the second highest by country is in India, 112 million Facebook users in India. You can use this platform from your own personal accounts to talk about the work that you do. But a great idea, I believe, for professional purposes is to open a Facebook page. And you can name it the way you want it. It can be after your own name. It can be the name of your practice, your hospital, or even the disease that you treat. And you can use this platform to send out information about the disease, post some photographs about the work that you do, and maybe put some patient testimonials there so the patients know more about the work that you do and potential patients know more about the work that you do. And of course, then there is Twitter. I personally believe that Twitter is a great way to stay in connection or connect with people who are doing similar work to you, who share similar interests that you have. And with that, you can also interact academically with a lot of experts in the field. I think it's a great way to follow latest information and latest feeds from various conferences, from the latest journals that are coming out, latest articles that are coming out, and generally you can put yourself out there using Twitter too. With LinkedIn, you can actually connect with professionals which are similar to you and share information with them. YouTube, I think most of us are probably using YouTube for professional purposes. We're already putting our videos there, and that's a great educational tool for everybody. But one thing that I really want to talk about is the importance of blogging. Now, blogging is probably the social media strategy which is least followed by us medical professionals. And there are a number of reasons why a doctor may want to blog. But there are two reasons why a doctor should strongly consider to blog. And the reason is that if you repeatedly put updates and posts and write about the interests that you have regarding the professional activity that you do, or the particular surgery, or the particular diseases that you treat, you create a demand for your expertise. So you are creating a trust between you and your potential patient even before he has come and met you. Most of the patients will do a net search for your name before they even walk into your chamber, before they take your appointment. And if they already know that you're talking about treatment of the disease that you have, there is an element of trust that's created, and that's going to help your practice. And the other thing is, which is very, very important, unlike any other social media platform, is that search engines love blogs. So if you're blogging about a particular disease using specific keywords, then it's very likely that the search engines are going to pick up what you have written, and you're going to be ranking very high when somebody types your name or the name of the disease on Google. Well, there are a number of benefits of social media. There's no doubt about it, because it can help you expand your professional and social network. It can facilitate public access to accurate information. If you just go to Google and type treatment of cancer, you'll be surprised what kind of things come up on Google, right from herbal medication to magic healers to cow urine. I mean, name it. You'll have all kinds of treatment, all kinds of inaccurate information there. You can do your bit to put forward correct, ethically, morally valid, scientifically valid treatments and make it known to the public, and you can do your contribution to educating patients and general public about the latest advancements in the treatment of the disease that you treat. This establishes you as a subject matter expert, builds your reputation, and then as a result of that, improves patient access to your services. In other words, it brings you more patients, it brings you more money. There have been a number of innovative ways in which social media has been used for robotic surgery. And one of these is this recent article which was published in Annals of Surgery, where Jim Hu and his colleagues in UCLA actually found out the role of social media as a treatment, as a training tool for robotic surgeons. So a group of fellows and residents who were learning how to do robotic surgery put up their video clips which they had recorded on simulators on social media and invited anonymous feedback from expert robotic surgeons. And they found that those people who had got this feedback did much better in their subsequent simulator sessions than those trainees who did not invite this kind of a feedback. So it's possible that social media in the future may play a role in training robotic surgeons. Another way to use social media is actually to live tweet your surgery, and this has been done in a number of different institutions for a number of different surgeries. So if you're doing a live robotic thymectomy, it's very easy. You just require a smartphone and somebody to help you in the OR, and you can actually live tweet the surgery with the steps, with the photographs, with short video clips, answer all the questions that come up from the lay public, and answer all the questions that come up from the other experts in the field. So that is a great way to build their awareness of the surgery and the work that you do. But along with the benefits also come risks. And these risks are actually significant risks, and one need to really know about it before you actually jump into the social media bandwagon. First and foremost is loss of personal privacy. So if you're using your personal accounts to interact with the world outside, you have to be very, very careful about what kind of pictures, information about you, your own family, are you putting up on these accounts. Because whatever you put is available to everybody is something which you never know who's seeing. There is a major issue of a potential breach of patient confidentiality. In the West, there is HIPAA, but here also, if you don't take care of patient confidentiality, you can get into trouble. A lot of your own colleagues, your peers, and even members of the lay public may think that your behavior on social media is unprofessional or it's inappropriate. So we have to draw a very thin line between blatant advertising versus conveying of information to the public. It's one thing to say, I'm the best robotic surgeon in India. Please come to me, I'll give you a discount. There's another thing, that prostate cancer surgery is probably best done with robotics, and we have one of the largest experiences in this field in our hospital. So you have to draw a thin line. It's as much a matter of personal choice as it is of public debate. But these are things that are likely to be major issues of debate when you're talking about using social media platforms. And of course, there's a potential for complaints if somebody doesn't like what you're saying. So a number of different institutions have actually come up with their own guidelines. A number of different organizations have talked about engaging responsibly with social media. One of the good ones is the BJUI guidelines, which have recently been published. And this is going to be my last slide. So I'm going to leave you with the things that we have to be careful about when engaging with social media. So first and foremost, you got to always know that whatever you put online is going to stay forever and is going to be available to everybody. So just understand that before you're actually writing something on social media platforms. You can tweak your privacy settings whichever way you want, but you have to know that it's going to be available to everybody. If you're posting as a doctor, people are going to have more trust in what you're saying. So it's a good idea to identify yourself. If your views are, if the views that you're expressing, those views may not actually be in sync with the views of your peers or the views of your institution. So you should state that the views are your own. Most importantly, perhaps, the way you behave online, your digital profile, the photographs that you put, the people that you follow, they should align with the standards of your profession. As doctors, we are expected to be at a higher moral ground than most people. So we have to follow that adage that applies to us. So if this is your idea of a Facebook profile picture, well, maybe you should think again. And to take it further, if you're one of the 1 million followers of this pleasant lady, then maybe your patients don't really need to know about it. So always it's also a good idea to disclose potential conflicts of interest. It's a good idea to maintain a professional boundary between you and your patient. So there has to be, don't get too personal with them on social media. Do not post a content in anger, because what you say stays forever and you never know what kind of a reaction may come back from the other side. You have to protect patient privacy and confidentiality at all times. Breach of confidentiality is a major issue which can land you into trouble with your institution and with the legal aspect also. And if you feel that any of your colleagues have posted something which is not appropriate, limit the damage, tap them on their shoulder and tell them, maybe this is not good, you can take it down. And of course, always be truthful and strive for accuracy, because that's what our profession is all about. Thank you very much.